Sure. All right. So BFR, Matt gave a presentation apparently a while ago. Just ignore what he did and just remember what I do. Okay. All right. Um, so BFR is actually a pretty, it's been around for a while. It's originally called Katsu training. I think it's Japanese in origin, but it's been around since like the 1950s. And I think it was like a mixed martial arts concept originally. But I think where people get confused about this concept is they think that you are completely cutting off blood supply to the limb, which you are not. So what we're doing is, as the title says, is that we are like blood flow restriction. So occlusion is the blockage or closing of a blood vessel or organ, which is essentially what happens when, for example, you have a cardiac arrest, the heart does not get any blood. And restriction is where we are limiting or controlling of someone or something. So all we're doing is restricting the system in how much blood we are delivering to that organ. We are not occluding it. We are not saying you are not getting any blood. What we're doing is just limiting the restriction of how much blood is getting in there. So applications. When I first started doing some research into blood flow restriction and started using this, one of the first papers that kind of came up was stuff where people are actually ambulatory. So they're not doing anything, like they're post-surgery and in their initial stages of recovery. They're not doing any sort of movement-based intervention with it on. But this paper looked at BFR application for ACLR post-surgery from the 3rd to the 14-day mark. And these people were actually still in the hospital in bed. They weren't doing any form of movement that is applied when we generally do BFR, or in our case, primarily do BFR. Yeah, so the experimental group had the blood flow restriction cuff on versus the control group. There was only 16 people in this study, but they did a protocol where they did a 5-minute inflation and then 3-minute deflation 5 times by 5, and they did that twice per day. I think it was like in the morning and evening with a few hours separation. The results of this I thought were actually pretty cool in the sense that the graph on the right-hand side shows in the experimental group, they had a far less loss in cross-sectional area compared to the control group that didn't have anything. So both groups didn't do any movement. One of the groups had the blood flow restriction cuff on, the other group didn't, right? No movement. All they did was pump up the cuff, let it on there for 5 minutes, deflated it, let it deflate for 3 minutes, and then pumped it back up for 5 minutes for 5 times. And they did that twice a day. So that's what the experimental group had. And they showed that although they lost cross-sectional area in their flexors and extensors, they didn't lose as much as the control group did when they had the same amount of time in bed. So I think that is a really cool application for this, is that I think it can help, particularly obviously like using ACLR as an example where we get a lot of like muscle wasting and things like that post-surgery, is that it potentially has the impact to negate how much loss these people have. So I think this is really cool. Some other research. So this paper looked at high intensity, which was 80% of 1RM, combined with low intensity and BFR, plus a group that did high intensity BFR, which is a combination, and low intensity. They did 12 sessions in total, and their strength was measured via isokinetic testing. So they had a few different groups. And the results in terms of strength. So the high intensity group, their pre-testing measures all kind of went up. So the pre-test is the first column. Second week they did testing, the fourth week they did testing, and then the sixth week they did testing. They all went up. The low intensity and BFR group, they had a big peak, but then a little bit of a drop off at week 6. The combination where they did high intensity and BFR training had slight increases to week 6, and then low intensity had some slight increases as well. But what do we know with resistance training is that if you apply stress to the system, it adapts. And this for me showed that if you're wanting to get strength gains, you need to be lifting at a decent enough intensity. And the one thing that the blood flow restriction doesn't allow you to do is lift at high intensities because of what it does. Right? So people say that BFR is better than heavy training. I don't necessarily agree. I think if your purpose is to get strong, we know that you need to expose your system into applying a large amount of force against an object to reduce force. And you cannot do that with the BFR cuff on, or your potential to do that goes down. So, Chella, this is predominantly for you. Matt, you're going to stay on mute. Chella, we spoke about last week about asking why. Right? We talked about the concept of like asking why and being inquisitive, right? So like Ted Lasso, you're going to be curious, not judgmental. Okay.
I only watched the first episode.
Okay, well this quote will come. How could this work? How could this concept of blood flow restriction training work? Why do you think the first study showed that people who didn't do anything and had the blood flow cuff on were able to have less muscle loss than the other group who didn't have it on?
My brain's not in thinking mode today, as we talked about this morning. Yeah, I'm not too sure why. I know we spoke.
Okay, look at the picture on the right, Charles.
Yeah.
What is this?
It's a mountain.
Okay, so when athletes...
changing the environment or depriving oxygen.
Good. Okay, so
stress to the system.
Stay on that concept, right? So what happens when you go to altitude training? Oh, sorry. What happens when you go in the mountains and try and exercise?
The oxygen availability is, less, which means you fatigue quicker. But it means that when you return back to an environment where there is a lot of oxygen, you can uptake and regulate and utilize oxygen more efficiently because you're used to applying that same intensity, but in an environment with far less oxygen.
Mm-hmm. Good. So what have you done by going up and training in the mountains?
You've reconditioned your body.
Yes, that's a product. That's a product of training there. But what, like, compared from being where we are at sea level to where these mountain ranges would be, what's the biggest change?
Oxygen availability.
Good. So the environment's changed.
Yeah.
Right. And at the end of the day, that environment change is a stress. Right. Yeah. It's a different stress. So when we're in altitude, right, we still breathe in the same volume of air, but the partial pressure of oxygen is different, right? It's a lot lower. Right. So when you've got oxygen, when you've got greater amount of oxygen available, your body has the ability to draw it in, right, at an easier rate and therefore use it. When you're starved of it, your system has to work harder in order to just maintain homeostasis. Right? Yeah. Then you add exercise on top of that, which is another stress. So you've changed the environment. That's a stress. You've then added exercise to it or load. That's another stress. Right? So that same concept, when we apply a cuff for blood flow restriction training, what are we doing?
Changing the environment.
Good. How are we changing the environment? What are we doing? So think of
Change-
normal blood flow, right? Pump, comes back, pump, comes back. With the cuff on, what are we doing?
restricting the amount of oxygenated blood that can enter the muscle.
That's one of them. Good. Right. So what happens? So you spoke about fatigability, right? So what happens if blood pools there and it can't come back?
Sorry, can you repeat that?
So when blood pools, so say for example, I've got it on my, just below my shoulder to train my biceps, right? If we restrict it from here, right, I'm cutting off or restricting circulation from my arm down and then back up, right? So you mentioned oxygen is one of them, right? So if blood can't really flow naturally, right, we're going to have this pooling effect.
Right, okay.
Okay. You with me so far? Follow?
Sort of.
Sort of. Okay. Do you remember your biology where you have the lock and key model for enzymes and shit?
Yeah,
Yes?
sort of, yeah.
Okay. So for reaction...
Sorry, I'd not much sleep last night and I'm really struggling to keep up right now.
All right. So for reactions to
Can
occur
I help with some of the answers too, Ads? So Charles.
Yes. Yeah, hang on. Just let me... This was meant to be... I forgot you were coming. This was actually meant to be directed at Chella. But anyway.
Okay.
From like a chemical reaction point of view, right?
Yeah.
You need to have a certain environment where those reactions can take place.
Yeah.
Right? So the lock and key model, right? All these little things are happening within the system, right? When the environment is neutral, right? Now, all of a sudden, we've blocked off or restricted the amount of blood that flows in. So the environment has changed, right? So these reactions don't happen as quickly and as nicely, right? So from a fatigability point of view, it goes up, right? So we can stress a muscle a little bit quicker when we've got this effect because of the fact that these chemical reactions that are trying to happen aren't happening as quickly and as rapidly. So we can't diffuse, we can't get rid of these metabolic byproducts of exercise as quickly as we can if we have normal flow going on, where we can pump it in and pump it out, right? Remember, because it's staying here, or it's pooling, not, it does go a little bit, but it's pooling predominantly in this section here.
Yeah.
Okay. So, Charles. Oh, crap. I'm going to. All right. Quiz. All right, Matt, you can join in on this. All right. So, Charles, when we go to altitude training, what do we do? What happens?
Heart rate goes up.
No. Before that, what are we changing?
The environment.
Good. Change the environment. Do we do the same thing in blood flow restriction training? Yes or no?
Yep.
Good. Okay. When we change the environment, what happens in altitude training? There's less what?
Changes. Oxygen availability changes.
Good. So O2 availability changes. Do you think that change happens in blood flow restriction training?
Well, yeah, because O2, not as much oxygenated blood can get to the working area.
Good. Good. So because there's O2 availability changes, so we have less. In the altitude training component, what does our system need to do in order to try and keep the oxygen going? What does our heart need to do, for example?
Increase heart rate.
Good. So we get an increase in heart rate. What else happens? In order for our heart rate to go up, if I'm
Mm.
trying to get more air in, how do I do that?
Your breathing rate will increase as well.
Good. So breathing rate goes up. I can spell right.
Are we getting really deep? And maybe even saying, I don't know, cardiac output would increase potentially.
So that's a benefit from when you come back down.
Right.
Because all of a sudden now your system's gone, holy shit, I've got all this oxygen now, right?
Yeah.
That's one of the benefits that happens. Great, Charles. So cardiac output is linked with what? What's the other one?
VO2 max.
Good. What's the other one? It's linked with cardiac output. Why can't I? Yeah.
Stroke volume.
Bingo. Stroke volume. Okay. Good. So we've essentially become more efficient when we come back down to sea level.
But only for 2 weeks.
Well, yeah, because your system's now become used to your new normal. Right? If you want more changes, you've got to go back up. Right? Back up to altitude. So we change the environment. We have O2 availability, which is less when we do blood flow restriction training. Right? What else do you think happens from like within that muscle system? Like, do you think we're able to flush out the like lactic acid and things as quickly?
No.
Do you think we have more lactic acid buildup or less with the restriction on or off?
More.
Good. Why, Chels?
Because your body's producing more hydrogen ion, so you need to produce more lactic as a buffering agent.
Yes, but what can't the blood do when the cuff is on?
Flush it out because it's pulled. Like
Good. So we have this pooling of metabolic byproducts. When we have these pooling of metabolic byproducts, what happens when we exercise? Do we find it easier or do we find it harder? Does our fatigue go up or fatigue go down?
It goes up. The fatigue.
Good. So fatigue increases, right?
Contractile force would decrease it as well, right?
Bingo. Contractile force goes down. Contractile force goes down. And because our fatigability is high and the system changes, we don't need to create as much stress to stress our motor units, right? So the threshold for contracting and using our motor units goes down because the system is different.
Right.
Right. So say, for example, like on a leg press or whatever, you may need to lift 80% of your 1RM to recruit 100% of your motor units, right?
Yeah.
But with the cuff on,
30% in order to get 100% motor unit recruitment.
boom. So we can potentially increase the threshold for using
motor units goes down.
Contracting motor units goes down, right? So we therefore, so what does that mean? Do we have to create the same amount of stress, or does that mean we could use less stress from an exercise?
Or less stimulus required in order to produce the same outcome as what you would achieve.
All right, Shelley, you can have a chop out now. You're done.
Oh, good. I'm struggling today.
But that was really good. Right? You applied the same thinking as what altitude does to what this does. So like you asked why, like why would this happen? All right. So this happens and then this happens and this happens, then this happens. Right? This is a perfect example of like, it's not exactly the same, but you can take the same concepts that altitude training and BFR has to try and understand why each of them work.
Yeah, I sort of see one more of a cardiovascular response and one's more of a musculoskeletal response or adaptation.
Yeah, but you could probably argue that they both do the same thing. Like, as in, like, it's not just like when you stress the system, you're stressing the whole thing. You're not just really targeting. Like, you might get more muscle damage by doing BFR compared to aerobic stress. So but that's not to say that aerobic stress isn't really happening.
So maybe if you did a 20-kilo squat at sea level, you might only recruit a small amount of motor units, but if you do a 20-kilo squat on the top of a mountain, you recruit more motor units.
You let me know.
I don't know if that was a silly or
I don't know. This is being inquisitive, Charles. Right? Like, what could, if we were to go to altitude training and then put the blood flow cuff on?
What was that, sorry?
If we were to go to altitude training and then do blood flow restriction training, what potential benefits could that be?
You look like Ronnie Coleman very quickly.
That's mad. I want to look like Ronnie Coleman. I've always wanted to look like Ronnie Coleman. Good. All right. So potential mechanism. Now, these are the things that have been researched or discussed, is that you get this cell swelling. So this in where the cuff is, the cell swells. And as a result, you get this venous pooling. So you get the blood that stays there and all the metabolic byproducts and stuff that stay there as a result. Because it stays there and doesn't have the ability to get out and flush the system out, we get this increase in metabolic formation and create this hypoxic environment where the oxygen is low within that system, right? So therefore, because the system is under fatigue, and then when we start adding stress or a movement to it, we can get for relatively less stress from a output point of view, we can get this high threshold motor unit recruitment, right? So this is potentially one of the mechanisms as to why BFR training has been shown to show hypertrophy outcomes. And then similarly from an mTOR pathway point of view, strength training elicits this response. So I don't think BFR necessarily does anything different to this. But these are the potential mechanisms that have been researched as to why BFR can work. But the same principles up here apply. Okay, so quick recap. We are not restricting blood flow. Sorry, we're restricting blood flow. We're not occluding it, right? So we're not cutting it off. We're restricting. Blood is still going in there, right? It's just harder for it to get back out. Establishing BFR pressure is not guesswork. So the research up here, if you look at these papers, they do have a way of calculating the cuff pressure for individuals. So it's not just guesswork. You're restricting blood flow for minutes, not hours, right? And I think the greatest area of benefit may be with ambulatory or early stage post-op rehab for when these clients physically can't lift the necessary loads to elicit these adaptations. We know that if people who are on BFR, they physically can't recruit or generate as much force as people who aren't on it.
I know when last year I tore my bicep off, that was what I used. Early stage, I was lifting like 1 kilo dumbbells or 2 kilo dumbbells, because my surgeon said literally like that's all you can
tolerate
mechanically, whilst it's healing. But it helped again, whether it did or didn't. But I was hoping it was helping to stimulate greater motor units, percentage of the muscle fibers, etc., etc. Yeah.
So you've changed the environment to make that 1 kilo feel heavier.
Mm-hmm. Yeah, it felt like 10 kilos.
Yeah.
Still use them, Matt, the cuffs that you bought?
Yeah. I need to give them to Adam so he can play around with it, because they're valved, and they, how you mentioned the pressure is not guesswork. Like it has it all preset. For legs, the occlusion pressure, and the arms, the percentage of occlusion pressure. It's all preset, and it inflates automatically. You don't have to manually pump it up with your hand or anything.
Yeah.
Yeah.
So now we'll get on to some safety tips. So research has covered ambulatory. I'm going to go back to this. Research has covered. Covered ambulatory and healthy individuals, and is safe to perform in these. I think more research needs to be done in individual chronic disease population to outline its capacity to be used as an intervention on a wider scope. And I'll get to the reasons to why I think that. Deep vein thrombosis, or formation of a clot that has the potential to travel, seems to be the biggest concern for researchers when implementing this method. Rhabdomyolysis has been presented in case report studies, but hard to outline that BFR is the cause of rhabdo. Potential to be safer in theory, as you don't have to stress the muscle as much to get hypertrophic adaptations. And the biggest concerns for potential clients or patients is if you use a tourniquet, is to get tourniquet pain, skin reaction to the material, dizziness, fainting, and numbness in the area. But as I said, if you're just pumping the shit out of the cuff and leaving it on the arm, then chances are these things are probably more likely to happen versus if there's a thought out pressure number. So if you're thinking about doing this, I want you to ask yourself 3 questions. Is the client similar to the subject in the studies you have examined? Does the treatment have a clinically relevant benefit that outweighs the potential risk? And is there another treatment available that will provide the desired result? Right, so these are the 3 questions I want you to ask yourself when you're thinking about doing blood flow restriction training with a client of yours. And my advice is if your client or patient can lift heavy, then lift heavy. Right? What we try to do is not many clients of ours want to come in and actually want to have big changes in their like a hypertrophy sense. What they want to be able to do is get strong. Right? And in order for us to get strong, we need to expose our system into lifting or pushing against a heavy object to try and create as much amount of force as we can. It might be a stepping stone into allowing your clients to do this, but if we want to try and increase our strength, strength is an expression of force, and trying to express force is a skill. So we want to try and expose our clients to doing that on a regular basis. Where I think it's got good scope is in the post-operative rehab space where clients are bedbound for a certain amount of time and you want to reduce how much atrophy happens, which is patients mobilized through sling or cast. So if someone is post-shoulder reconstruction in a sling and physically cannot move that arm for 4 to 6 weeks, could you potentially do some sort of BFR training without the movement component to slow down the rate at which that system gets atrophied? So for bodybuilders who have to create a lot of stress, they will sometimes train twice a day. Creating a lot of stress has a big impact on your central nervous system. Could there be a component of their training where they do blood flow restriction training where it's more of a peripheral stressor rather than a central nervous system fatigue? So they can potentially still get the same amount of training in, they just don't feel as banged up and sore. Could it be something that you use during your deload weeks where you still want to accrue some sort of stress with your clients but don't want to put them through the same program that you've been doing with them? Could it be a part of your deload week? And obviously for people who can't lift heavy, whether that's because of early stage post-op, they're not technically sound to lift heavy weights yet. Could this be a way of creating extra stress on the system to change? This is where I think it's got some scope.
Yeah, even it even works well with your, I don't know, your people with, you say, your Neo A or who struggle with a lot of knee flexion, weight like weight bearing, loaded stuff, or your masters type of athletes, who've got big training histories and high load movements might not agree with them as much, but BFR might be obviously there's lower load on the machine or whatever movement you're doing. So that's worked well for me in the past with those older age group people if they're not high risk.
So the fatiguing mechanisms of blood flow restriction and lifting weights is very different, which is why you can apply in deload week.
Yeah.
Okay.
Yeah. Well, where you potentially could apply it in the deload week, right? Like if you say, for example, wanted someone to have a complete week off and you said, right, we're going to do, I know, instead of them doing a leg extension to an RPE 8, right, and in your deload week, we're going to make it an RPE 5. You could make that RPE 5 different if you had blood flow restriction on compared to when you didn't have it on. It's still a deload because they're reducing the overall work that they're doing, but you're still creating stress
on the system.
Yeah. So this is where I think it's got some potential scope. I haven't really seen it being done in the deload week, but this is what I was just thinking of when I was coming up with the pres. So these are some resources. This symposium is pretty cool. If you want to look at some more things, it's on YouTube. The We Do Science podcast, that's really good. And then What We Know About Blood Flow Restriction Training is an article from the Physio Network, which is a nice little read if you want to, if you're thinking about using it. And that's it.
Nice.
Well done, Charles.
Good job,
You did
guys.
well.
Thank you.
All you
I
just
might
need to
even-
do is ask why.
I might even send my I was just looking at my presentation. If you want a refresher on the exact limb occlusion pressures, if you do decide to use it within clinic, because we do have it available if you do have a client that you'd like to use it for, it's at Splash at the moment. But if you want a refresher on the exact percentages, I'll post that stuff up if you want. So the AIS put out a position statement on utilizing blood flow restriction training and what are safe, they call it